Hi everyone, Professor Feldman. This video is going to show you how to do the surgical asepsis wound care lab that we have for you. We are going to show you how to gather supplies. We're going to show you how to put on sterile gloves. And we're going to show you two separate dressing changes. One will be a cleansing dressing change and one will be a plain dry sterile dressing change. So hope you enjoy the video and we'll see you in the lab. So before we go into the lab to actually assess our patient and do a dressing change, there's just a little bit of an overview that I want to go over and information that you should need to hopefully help you have a successful certification. So the first thing that you want to do is you want to verify that there is a doctor's order to change this dressing. Because you don't want to be doing a dressing change without an order. And then you want to go into your patient's room to assess your patient. You want to see if they have to go to the bathroom. You want to assess if they have any pain. You want to assess when the last time the dressing was changed, because maybe one of your colleagues helped you because they saw you were behind and did your dressing change. So that's what you want to assess for your patient. Obviously, if your patient is having pain, you would want to give them some medication prior to this dressing change. Once you've assessed your patient, now you're going to go into the supply closet and gather the supplies. And remember, you're going to be checking the supplies to make sure that they're still sterile by checking the expiration date and to see if there are any rips or tears in them. Then once you've gathered the appropriate supplies, you go back into your patient's room. And then you want to make sure that you're cleaning off the bedside table and just wiping it down. Urinals, bedpans, food, newspapers, whatever goes on this bedside table. So just wipe it down with one of the hospital cloths or soap and water, whichever is available in the facility that you are in. And you want to make sure that it's just wiped down and then dried, because if it's wet and you open your dressing supplies, the wicking through the water will go into the dressing supplies, making them unsterile. And then you want to either remove the dressing first or open your sterile supplies. Again, either way, it wouldn't matter. I always just take off my old dressing first. That was just how I was taught. That's just how I do it. But again, if you want to open the supplies first, just remember the principles of surgical asepsis, as long as you're not turning your back on either the patient's wound or your open dressing supplies. Again, turning your back is the biggest culprit for fundamental students until they're learning how to get this down pat. So make sure you're not turning your back and reaching over your sterile field. Hand washing is a must when you're opening packages, before you open packages, after you've opened the packages, after you've taken off the old dressing, before you're putting on tape. So you're going to be doing frequent hand washing throughout this procedure. So it's good to get a bottle of hand sanitizer. Again, after you've taken off the old dressing supplies, you want to assess that wound for drainage, how many sutures or staples are there, is there erythema around the wound, is the edges well approximated. So what does your wound look like? Because you're going to have to document that in your nurse's note. And then the biggest thing too that also can mess up students is when they're looking at the scenario for certification, it will tell you either to cleanse it or it just needs a DSD that requires changing. So make sure you're looking to see, is the word cleanse in there? Then you would know you need to clean it. And if it just says DSD, then you know it just needs an old dressing removed and a new one put on with no cleaning. So just really pay attention to what your scenario is saying. Make sure you're following these steps in the video, listening to ATI, and listening to your lab instructors. Thank you. I'm going to be showing you how to put on sterile gloves. It is a little bit different than putting on regular gloves because they're much more tighter than regular gloves, and they don't have sizes as small, medium, and large. Generally, they have sizes 6, 6.5, 7, 7.5, and so forth. So you have to make sure you find the right size that fits your hand. And we will be fitting you in the lab to make sure we are giving you the right size gloves so you can practice this skill at home. So I've already went into my supply closet and have retrieved my pair of sterile gloves, and you can see they're all packaged. It's in a nice outside plastic package. What I'm looking for is an expiration date. I'm making sure it's not open, ripped, or torn. And my expiration date is fine and it is not ripped or torn. So what I'm going to do now is open this package of sterile gloves. And it doesn't matter how you open this, it doesn't have to be anything special because the outside package has been in with every other supply. It's just the inside package that you have to be a little bit more careful for. I'm just gonna put this outer wrapping aside. And as you can see on my outside here, it says 7.5, so that's the size that I wear. And so I'm gonna open the package. Now when I open the package, I really wanna be very careful not to touch the inside edges. So I'm gonna open it carefully. And as you can see when you look here, it says left and right. They mark it so you know which hands to put it on. And so I'm just gonna unfold my edges really carefully, not to touch within my 1-inch border because I don't want to make my package unsterile. But as you can see, and especially don't touch this inside line because that is where the gloves are packaged and you don't want to be touching that area. So I'm just opening, wrinkling the creases just so I can make sure it doesn't flap back. Because if this flaps back, then that would mean that I've just made my packages unsterile. So I'm gonna get the outside flap underneath. I'm going to open it. Again, I'm keeping my thumbs within the 1-inch border, ensuring sterility of my gloves. And again, I don't want my gloves to fall back, so I'm just making sure that the package stays open by creasing the paper. Okay, so I now know my package is gonna stay open, so I know that this is fine. I know ATI in the book says to pick up your dominant hand, but I always pick up my non-dominant hand. It doesn't matter to us if you pick up the dominant or non-dominant hand first, as long as you maintain sterility of your gloves. And so what I'm going to do is pick up my non-dominant hand glove with my dominant hand, and I'm going to take a step back because I don't want to be standing over that glove to potentially contaminate the glove. So you always take a step back, and I'm going to put it on. You don't really want to fiddle with the cuff too much unless it's really over your hand, but you really don't want to fiddle with it too much because there's a potential that you could make your other glove unsterile. And so what I'm going to do now is I can't do the same way because if I picked up my glove like I did with the last one and I went to go put my hand in it, my hand is going to touch the thumb and that would be incorrect. So how you pick this second glove up is you want to hold your paper down and pick it up and tuck your hands in the side of the glove like that. I don't have to step back because there's nothing else here on my table. So what I'm going to do is put my thumb in, but with my gloved thumb you want to kind of hitchhike it because you don't, if I put on my thumb down here, I would contaminate. So you keep your thumb up and you put your other glove on. Again, remember the principles of sterile technique and putting on sterile gloves. You want to make sure that you are keeping your hands above waist level, but below shoulder length. You don't want to go behind your back. You don't want to go above your shoulders. You want to make sure your hands are in front of you within your field of vision. And so once you have your sterile gloves on, you're ready to proceed. So now that I've assessed my patient, I want to come into the supply room and gather all of my supplies. So I'm going to be doing an abdominal wound change. And so when you get into the lab, this is what you may be seeing. You're going to either see the mannequin, this is the mannequin. So what you will see is either the suture line or you will have a drain. So it could be a Jackson Pratt drain or a Penrose drain. In either case, you will have a drain. You will never have both, you'll only have one of the two. So if you happen to have the suture line, the materials that you will need to gather from your supply room will be a gauze sponge. And what you're looking for is an expiration date and making sure the packages aren't ripped, torn, or expired. And these are good. And you should always gather two, just in case you make ripped one or it dropped on the floor, just so you have a second one. And because I'm cleaning this dressing, this wound, I need a super sponge. And again, I'm going to be checking my packages for rips, tears, or expiration dates, and I'm gathering two of those. What I'm also going to need is a roll of tape, and I'm going to need something to clean it with. And so what I need to clean it with is normal saline. And again, I want to make sure that this bottle hasn't been opened. And if this bottle is in my patient's room and it's dated and timed, then I can use it. If it's not dated and timed in your patient's room, you have no idea when this was open, so you need to get rid of it. okay? But this is not expired. It hasn't been opened, so I'm okay to use this. So this is what I would use. These are the supplies that I would use if I was going to change my patient's incision line. If I'm going to change my patient's drain, because again, remember, you will not have both. What I'm going to need to do for my patient with the drain, I'm going to need drain sponges. And again, I want to be checking to make sure the packages hasn't been ripped, torn, or expired, which these are fine. I also, again, I'm cleansing this, so I want to gather 2 super sponges and make sure that these have not expired, been ripped, or torn either. I'm going to need tape, and I'm going to need a cleansing agent. And those are the B supplies that I would be gathering for my patients with an abdominal wound or an abdominal Penrose drain or Jackson Pratt drain that needs to be changed. Okay, so I've gathered my supplies for my abdominal wound, and I've wiped down my bedside tape, my patient's bedside table, and I'm going to now set up my tray. And remember, I've grabbed 2 of everything, and I've checked the expiration date while in the supply closet. So I don't need both. So I am going to put one aside on the away. I have my saline and I have hand sanitizer. So what I'm first going to do is going to take off the old dressing. And again, you can take off the dressing first, open supplies first, it doesn't really matter. I just like to take off the dressing to see what I am looking at before I change the dressing. And obviously I don't have a mannequin present, so I do have a mannequin's abdomen. So I'm going to take off this old dressing. Okay, so now I'm going to take off my dressing, and if the nurse before you has left tabs, that would be great. It actually helps preserve the patient's skin, because if not, what you end up doing is starting to pick it. Well, paper tape would come off easy, but other hospital tape won't come off as easy. So try to make tabs when you're putting your tape on, because it helps to remove the dressing much more easy, which will really in the long run save your patient's skin. And as you can see, as I'm peeling the tape, I'm folding the patient's skin down so it doesn't come into to the tape. And I'm just grabbing the tape and holding the skin all along the wound. Okay, so now that the tape is loosened, what I want to do is remove each layer of dressing material one at a time. And so I'm going to remove the ABD pad, and what I want to do is see if there's any fluid that is leaked onto the ABD pad. And so I can see that there's serous drainage on my drain sponge, but there isn't any on the ABD pad, which happens to be taped, so I'm going to leave it. And now I want to remove my ABD pad, and I want to just note how much serous fluid is there so that I can document it properly in my note. And I'm just going to remove the serous gauze and take it away. Now, I'm going to take off my gloves because I just changed a dirty dressing. I'm going to sanitize my hands, and I am going to assess it. So remember though, you'll either have the sutures or staples or you'll have the drain. So either one. For this particular one I'm going to show you is the drain. So you're going to have to pretend that you do not see that, and I'll show you how to do both. Okay, so what I'm looking for here, is there any redness? Is it open? What does it look like? Is it draining? Is the Jackson Pratt activated? If it's a Penrose, is it still intact? Okay, so everything looks good here. So now what I'm going to do, I want to make sure, again, I'm not turning my back, but I want to open now my packages. And just like with the other one, I like to break the seal on the top of the package, spread out my fingers, and open in one motion, making sure not to go over with my elbow, because that is considered the patient's sterile field. And again, just like with the heel when I was cleansing it, I'm going to palm the bottle, the label, and lip the bottle, just to get the stuff off the lip of the bottle. 4 to 6 inches, I'm going to pour my normal saline. making sure it doesn't splash, because then the wicking action on the other dressing supplies will become contaminated. So for my drain sponge, again, I want to undo the seal. And I just have to move this a little, and I can because I'm within my 1-inch border. And with my fingers, I'm going to spread out and open my dressing supply. If you wanted to open it from this end to this end, that would have been fine as well. I just happened to do it this way. Again, it's not right or wrong to start this way or this way to this way. Just make sure you're not going over your packages and keeping everything sterile. And that's the key to this particular lab, is ensuring sterility of the packages. So I have just ripped my package. So if that should happen in certification, you can ask your lab instructor, should I start over? Would you like me to reopen it? And they'll either tell you to open it again or keep on going. And so I'm going to keep on going. Okay. Now I'm going to put on my gloves again. I'm going to sanitize, clean my hands again, because I don't know who touched those packages. And I'm going to put on my gloves, my clean gloves, not my sterile gloves. And remember, if this is a really big in-depth procedure, you would most likely be wearing sterile gloves, but this is a simple procedure, and clean gloves with sterile supplies is fine. Now remember, I can't go over it because, again, these are sterile. So again, I want to grab the corner, but you see how I have my arms kind of in? Again, like one student said in the past, it's like dinosaur arms. You kind of... So the principles of surgical asepsis, you want to do clean to dirty. So figure this is an abdomen. So if the person's head's here, their perineal area is here, the top part is clean, and you want to clean from furthest to closest. So I can either do it this way, or I can switch hands. It's okay either way. So I'm going to just top to bottom, and I'm cleaning, and I'm just going to do a little push away, because you don't want to just do it straight down. Microorganisms that may be there would then be potentially introduced into the wound. So it's down straight and a little curve out. And then drop it in your trash barrel. I'm not just dropping it on the floor, there's actually something there. And the same. Now, I don't really want to do it with this hand because I would be washing over my clean area. So I really want to do it with my right hand. And again, it's top to bottom and around. Now you just want to make sure that this is dry. And when it is dry, you want to put on your drain sponge. Now there's 2 drain sponge in the packages. I like to fold it because you have to have them go in opposite angles. And I'm, again, touching the corner. So I kind of put the slit over, and I kind of hold the dressing and manipulate it so it goes around without touching the bottom. So see how that was like that? I'm going to now take my second drain sponge and put it in the opposite direction. Okay. If it was crooked, if it was like this, I would never want to do that, because again, anytime you're moving the dressing, it could be introducing microorganisms. And now the ABD pad, again, you can just grab the top and lay it right on the top. And then I would tape it. So that was a cleansing drain. If you have just a dry sterile dressing for a drain, you're going to pretty much do all of the steps up until this point, but rather than cleaning with the saline, I just have to take the old dressing off and apply a new dressing. So I would just take off the old ABD pad with the drain sponge and apply a dry, sterile, DSD is what it stands for, dressing on the drain. And then I would cover it with the ABD pad and tape, as in the first one with the tabs, date, time, and initial. Now, if you happen to have, that was for the drain. You may get the drain or you may get the incision line. So remember, you have one or the other, it will not be both. So if you happen to have the incision line, what you're going to do is the same. You're going to set up your table and you're going to cleanse it. So now if you have a cleansing, you're going to take one of the super sponges with normal saline, and remember the principles of surgical asepsis. You want to clean furthest to closest, top to bottom. So I'm going to do this one over here, start at the top and work my way down. I'm pretending that this drain is not here, so it's down and out a little bit. And then I'm going to take my second gauze sponge and down and out again. What I'm doing different, rather than putting drain sponges, I am going to put a gauze, a 4x4 gauze. Don't forget to check the incision line. How many sutures or staples are in the wound? Are the edges well approximated? Is there erythema around the wound? These are all of the things that you need to notice, okay? Once you've counted your staples or sutures and you've assessed the wound thoroughly, you now put the gauze pad on it, the ABD pad on it, and then you would tape just as you would for the first dressings. Now, if you just had an abdominal incision that needed a changing now, a dry sterile dressing, you would take off the old dressing, again, assess the wound, apply the gauze pad without cleaning. Cleansing means cleaning. DSD just means you take off the old, you put on the new. And I put the ABD pad on, and then I would tape. Good morning, I'm Karen. I'm going to be your nurse today. I was going to do dressing change on your heel, but I have a couple of questions before we start. Are you having any pain right now?
It's about a 1 or 2.
Okay. Do you need something for pain before we start, or do you think you're okay?
I think I'll be okay.
Okay, and do you have to go to the bathroom?
No.
Okay, so why I asked her those questions is to make sure that all of her needs are taken care of before I start her dressing change, because if we were in the middle of opening all our supplies and then she says she has to go to the bathroom or the pain's intolerable, I would have to stop and then open all the dressing supplies, which is a waste of resources. So we always like to make sure you ask the patient before you start any procedure. So since all of her needs are fine, I'm gonna go into the supply room to grab the dressings, supplies, and then I will be back into the room to do the dressing change. So I'll be right back. Just gonna go grab the stuff and I'll be right back. Now that I've assessed my patient's heel wound, I'm going to go back into the supply closet to grab my supplies that I will need for this dressing change. And so while I'm in there, again, I'm going to be cleaning it. So I'm going to need to use a super sponge. And again, I'm checking my packages for expiration dates, rips, tears, and making sure they're sterility is still intact. And because this is only on a heel, it isn't too big, I could either take a 4x4 and fold it in half, or I could just take a 2x2, which is easier because that is the size of the heel. Either one would be fine. Again, what are the principles of sterile technique? Are you maintaining sterility? And again, I'm looking to make sure these 2x2s haven't been ripped, torn, or haven't expired, and these are fine. And what I'm going to need, which is different, I'm going to need a gauze wrap because you can't just tape on a heel. So you have to wrap it. And again, I want to check to make sure it hasn't been ripped, torn, or expired. I'm going to need tape. And I'm going to need my cleaning agent again. And then the last thing that I'm going to need is I'm going to need a measuring device because I'm going to have to measure the opening on this heel wound. And so I'm going to take a measuring device to measure it so I can document that in my nurse's note. And anytime you're gathering supplies, you always want to make sure your hands are being washed before and after touching the supplies, and you anytime before and after touching gloves, just like you were taught in class and in the textbook in ATI. Okay, so now I'm back into the room. I have gathered my supplies. I'm going to identify my patient with her name and date of birth, and then I'm going to set up my field. So I've confirmed name and date of birth with the patient, and as you can see, I've brought 2 of every supply, but I don't need to. It's just in case I've dropped something on the floor. So I'm just gonna put these on the bedside table. And so how I wanna do this is I wanna set it up in order of how I'm going to do my supplies. So I'm gonna clean first, then I'm gonna put the gauze on top of that, and then wrap it. I just need gloves, hand sanitizer, and also some saline. And because this is a round, open wound, it's a pressure wound, I'm going to measure it just to see where, how deep or has the size of this changed. So before I open any supplies, I wanna make sure I wash down my table, and then I wanna make sure I hand sanitize, and then I'm going to put on my gloves because I wanna take off this old dressing first. And all the while, I'm just gonna make sure, I'm gonna ask her again about pain because it could have changed from the time that I was in the supply room until now. And what I wanna look here is just check for the date and the time and a person's initials, because if this was just changed, there's no reason for me to be changing it now. And what I wanna be looking for, is there any drainage on the outside of the gauze, which I do not see any. Now this is gonna be hard because her foot's on the bed, and if she was really old and couldn't lift her leg, what I would wanna do is grab a pillow and just put it under her leg. Just gonna lift your leg and put it on the pillow. But I don't want the pillow in the way of the gauze. So sometimes you just have to readjust it. Okay, is that comfortable?
Yeah.
Okay. And you don't really wanna just yank this off because you don't know what's underneath a dressing. If you had a Chuck's pad or a towel or a face cloth, just because if I just changed this bed and something fell out of it, I don't want to have to change it again. Think of saving yourself time. And I like to hold it, the last one, just so it doesn't fall on the bed. And now, if I went to go take this off and it was stuck, I may have to figure out how to get that off. But if it comes off easy, just peel it off slow. And what I'm looking for is, is there any drainage on her dressings? Which this looks pink, and from your surgical asepsis lecture, this is called serosanguinous. And then what I want to do is look at her wound. Now I want to make sure that I'm not turning my back to her wound, because now that would be considered contaminated. So I would put this in the trash. And I want to measure this. So I'm just going to move my table up a little bit. And I don't have to worry about contaminating anything. I haven't opened anything on my table yet. So this looks to be about 3 centimeters. You don't want to put this right on her skin because this is plastic. It can be wiped down and be reused. So 3 centimeter wound. It isn't deep. It's just a little bit pink. It's not really deep, so I don't have to worry about cleaning too much inside. Okay, so now I'm gonna take off my gloves. I'm gonna sanitize my hands, and then I'm gonna open up my supplies. And remember, when you're opening up your supplies, you wanna make sure you're keeping your edges. Remember that 1-inch border that we talked about. You just kind of want to break the seal on these dressings. And when I was in the supply room, remember I've already checked my expiration and making sure the packages aren't ripped, torn, or expired. And you open the package away from you. Now, I have to add my liquids to this, and so you want to make sure this is the correct supply, because I got it from the supply closet. I'm going to palm the label because I don't want to have any liquids dripping down. And what we do is, it's called lipping the bottle. Okay, so I'm going to lip the bottle, and in the barrel that's right below me, I'm just getting rid of that initial first drops of saline just to make sure there's no microorganisms in there. Again, if you had just opened this bottle, you don't really need to do that because inside is already sterile. So I'm gonna pour this 4 to 6 inches, trying not to splash. You don't need to super soak it, you just have to get it moist, depending on what you saw in the wound when you opened, when you took off the dressing. Hers wasn't really all that dirty, so I just needed a little bit of saline. So I'm gonna get this off my table so I can not have it interfere in my direction. Now with these next couple of gauze, you have to really make sure, because if I opened it this way, like I did the last time, my arm is over my supplies, which would then make this unsterile. So what I'm going to do, again, is I'm going to break the seal on this 2x2. I'm gonna hold it down with my fingers, but this time I'm gonna not go that way, I'm gonna go this way so I don't contaminate that gauze. Now, as you can see, that went in within my 1-inch border. If that happened during certification, just ask your clinical, your lab instructor what they would like you to do. My lab instructor told me to proceed, so I'm just gonna put that right there. And I'm going to now open my gauze, my wrap, same way, hold that down. And there we go. I'm gonna hand sanitize again before, because I don't know what was on those supplies. And I'm going to put on my gloves. So what I'm going to do is take the gauze in the corners. Now remember, I can't really reach over here or I would have contaminated this one. So you kind of have to have, as another student said in the past, like T-Rex arms, you kind of want to not really touch too much, okay? And because it's a heel wound that is a little bit open, what I want to do is start in the center and work my way out. And I didn't drop my gauze and then put it in the trash, I just let it fall, okay? If this was really dirty, you may need more of these, but if it's not too dirty, 2 should be fine. And I would do it again, work my way in and work my way out. You would wait for that to dry. I would then pick up the 2x2 in the corner, and I can do that with my clean gloves because I'm not touching the center that's sterile, going right on her wound. I'm going to take my gauze and start wrapping. And remember, you want to anchor this down first, but you really want to try to get just gonna lift that a little bit of a figure 8 so it can really stay in place. But you really want to make sure that this is secured first. These gauze that we have for practicing in the lab are kind of on the small side, but they can do the trick. You can still get your wrap done as you need it. But in the clinical setting, these are much bigger to give you more padding on that heel, especially if that was deep and it was painful. Your patient would appreciate it. Okay. So now I'm going to get my tape. I am going to take off my gloves because I do not need them anymore. Her wound is covered. And what you don't want to do is write on the patient's body. You don't want to be writing on the tape. So I'm going to write on the tape itself. So today is January, if my pen will write, 6th, 21. It is 1300. Most places go by military time, so make sure you know what your facility's policies is, and then it's your initials. To be nice to the nurse behind you, make a little tab so it's easy to find and pull on this and secure that nicely. If this did not need to be cleansed, what I would do is assess her wound, look at the old bandage to see if there's any drainage, put on a new 2x2 and wrap it. And that is how you would do an ankle dressing. Okay, so now that I have shown you how to do a dressing change, some of the exudate or drainage that you may see in a wound, we've demonstrated here today. So what this one is clear or straw colored. It's really thin, and that's because it's composed mostly of the serous, from serum, the clear liquidy part of the blood. This bloody one is called sanguinous because it is mostly filled with red blood cells, making it red and bloody. This one is a combination of these two. So this is a combination of serous and sanguinous, so they call it serosanguinous. It looks pinkish tinged. It's thin, and it can have a pink tinge to it. This is not to be confused with this light straw colored one. This is thick and it's yellow, or it could be green, or a combination of yellow green. It could also have a little bit of brown in it depending on how dirty the wound is. It usually has a foul odor associated with it, and it's really thick. That means there's an infection in the wound. This definitely would need to be cleaned out of the wound bed, and that is called purulent. And then this is a combination of purulent and sanguinous because it's got a little bit of blood and pus in it, so it's called purosanguinous. And you may see this one would also definitely need to be cleaned out of the wound bed because there's an infection going on with either one of these two. So that was our sterile dressing wound care lab. And you will be learning how to put on sterile gloves. You will be doing a dressing change on an abdomen or a heel, or it could be a thigh. You just remember all of the principles of surgical asepsis that you learned in class and in ATI, and what you learned today in our whiteboard for this lab. And for certification, you're either going to get an abdominal drain, abdominal incision, a thigh, or a heel. Any of those could be cleansing or dry sterile dressing. You just have to really make sure you're looking at the scenario to see what it is telling you so you can follow the doctor's orders. If you have any questions, please feel free to bring them to your lab instructor, and we will see you in the lab for some dressing changes.